Hi everyone, welcome to Raaonline. This is Dr. Ashok, consultant clinical microbiologist. So today we are going to see a case study series. In the last session we have studied about the theoretical aspect of Pneumocystis infection. So now I will show you a case and I will show you an image. Following that we have a set of questions, let us answer one by one. So this is a case study. So we have a 56-year-old male and who is a case of PL-HIV. So which stands for PL-HIV stands for people living with HIV. So we address them as PL-HIV. So developed fever associated with cough and frothy sputum. And you are able to see the clinical examination which is suggestive of pneumonia, and CT scan showed ground glass opacities. History of irregular medication history was present. So whenever we have a patient with HIV, so they take something called ART or antiretroviral therapy. So whenever they are not going to take the ART properly, it is going to lead to decrease in the CD4 count, and which is going to lead to something called opportunistic infection. Okay, now his recent CD4 count is going to be 102 cell per millimeter cube. With a suspicion of opportunistic infection, the sputum smear was subject to a special GMS stain which showed the following. Okay, so whenever we have the CD4 cell count, so we must know about the normal CD4. So the normal CD4. So can anyone tell what is the normal CD4 count? It is going to be between 500 to 1500 cells per millimeter cube. So this is going to be the normal CD4 count. So whenever there is going to be an CD4 count of less than 500, the patient can go for various opportunistic infection. So here the particular cell count is going to be 102, which is going to be very less. So the patient is going to be suffering from opportunistic infection, and here there is going to be a special stain called GMS stain, that is the Gomori methenamine silver stain. So it is going to be a fungal selective stain. So can anyone tell what is the principle of this particular staining procedure? So in the last class, in the overview of fungal infection, we have studied about the mechanism of GMS stain. So let us see about the mechanism once again. So here there is going to be a mucopolysaccharide component. So there is going to be a mucopolysaccharide component of the fungal cell wall which is oxidized to release the aldehyde group. The aldehyde group then reacts with the silver nitrate, reducing it to the metallic silver. So due to the reduction in the metallic silver, the particular fungus is going to appear as dark brown to black, and there is going to be a green background. So here you are able to see green background, and the fungal structure they are going to be brown to black. Fungal structures, so due to the reduction of metallic silver. Okay, so we will see the question and answer. So what type of pneumonia does it cause and why? So this particular organism causes pneumonia called as plasma cell pneumonia, because there is going to be recruitment of two alveoli induced by trophocytes of Pneumocystis. So there is going to be frothy alveolar exudation. So there is going to be a tissue injury and inflammation which is mediated by the plasma cell. That is why it is called as plasma cell pneumonia.